Have you ever wondered which ABG value specifically tells us about a patient's oxygen status? While many students get confused between various gas levels, there is one primary indicator to watch. We need to identify if the patient is actually getting enough oxygen into their blood.
PaO2 is the specific value that shows how much oxygen is physically dissolved in the arterial blood. Unlike PaCO2, which measures ventilation, PaO2 directly reflects the efficiency of oxygenation from the lungs. This measurement is crucial for determining if the blood is adequately oxygen-rich.
When you see a low PaO2 value, it indicates a significant oxygenation problem that requires immediate nursing assessment. Nurses must monitor these levels to ensure tissues receive enough oxygen to function properly. Remember, for oxygen status, PaO2 is your go-to clinical indicator.